Welcome back to ABC-7 at 4. As we mentioned before the break, colorectal cancer claimed the life of actor Chadwick Boseman. And since March is Colorectal Cancer Awareness Month, we wanted to provide you with the life-saving information that you need. Joining me now is Dr. Jaime Gomez. He's a board-certified colon and rectal surgeon with the Hospitals of Providence. Dr. Gomez, talk about the importance of getting screened.
Well, screening is incredibly important because the early detection, the higher survivability. In fact, we can have over a 90% survival rate if patients are screened early enough. Now, also another thing about the screening colonoscopy specifically, is that we can detect lesions, colon cancer, before there's any symptoms. And right now, probably 1 out of 3 patients isn't keeping up with their screenings, but it's vitally important for early detection and higher survivability.
So at what age should screenings begin?
Now it's 45 for both men and women. It used to be 50, and that was ingrained in everybody's brains for decades. But now for both men and women, screening colonoscopies start at the age of 45.
What are the signs of colorectal cancer, doctor?
Well, unfortunately, the early signs are basically none. Okay, that's a problem with colorectal cancer, is that it's asymptomatic for a long time while the tumor is growing. That's why screening colonoscopy is so important. So the most common symptom is none. But however, after that, patients can develop rectal bleeding, change in bowel habits like thinning in the stools, increasing constipation, bloating, distension, abdominal cramping, weight loss. But once again, early detection is key because colon cancer essentially has no symptoms in the early stages.
And there are some risk factors that people should be aware of.
Oh, yes. Definitely a family history of colon cancer is a high risk factor. Family history of colon polyps. Also, type 2 diabetes, obesity, a diet high in red meat, and alcohol use. Also, there's other diseases that increase the risk, such as Crohn's disease and ulcerative colitis.
So how treatable is colon cancer?
If it's detected early, it's very treatable, even curable. So it all depends on the stage of the lesion of the colon cancer when it's first diagnosed. So the earlier, the better. So that's why at the age of 45, patients need to go to their doctor and get the colonoscopy scheduled.
Now, you all have a seminar coming up on March 18th where the public can find out more details. How do folks get involved with this?
Oh, it's on the Hospitals of Providence website. We're giving a seminar on March 18th.
And we'll have a link to folks to sign up for that web seminar on our website, kvia.com.
Yes.
Dr. Jaime Gomez, thank you very much for joining us today.
Thank you very much.